All right, today we're going to scrub in and take a trip deep inside the operating room. We're going to break down step by step how surgeons pull off an incredibly complex and delicate procedure, the laparoscopic removal of the spleen.
And yeah, that brings us to the biggest question of all. It sounds kind of impossible, doesn't it? How on earth do you remove an entire organ, something about the size of your fist, through a tiny little incision? Well, stick around, because we're about to show you exactly how they do it. Now, before we jump into the how, let's quickly talk about the why. For a bunch of different medical reasons, maybe trauma, certain blood disorders, or even cancers, the spleen sometimes just has to come out. And for any patient, that whole journey starts way before a surgeon makes a single cut.
Right, because in surgery, success doesn't just start with the scalpel. No way. It all begins with super careful, meticulous preparation. Everything is planned out to make the operation as smooth and safe as it can possibly be. And it all kicks off with how the patient is positioned on the table.
This is the first really clever strategic move. See, the patient isn't just lying flat. They're positioned in a very specific way that actually turns gravity, the force of nature, into the surgeon's #1 assistant.
And that specific position? It's got a name. Reverse Trendelenburg. Just think of it like tilting a box full of toys. All the stuff you don't need just kind of slides to one side, giving you a perfect, clear view of the one toy you're trying to grab. It's a simple bit of physics that makes a massive difference in the OR.
Okay, so with the patient positioned just right, it's time to create the entry points. These are the famous keyholes you hear about in keyhole surgery. A camera port goes in near the belly button. That's how the surgeon gets their eyes inside the body. Then a couple of smaller ports are placed for the instruments. And believe it or not, these tiny openings are all they need for the entire operation.
So the stage is set, the ports are in, now we're heading inside. This is where we get to see the intricate dance of modern surgery, step by step.
The very first thing the surgeon does once they're inside is just explore. They use the camera to get the lay of the land, kind of like a scout mapping out the terrain. They're looking for any abnormalities and also for something called spleneculi. These are tiny extra bits of spleen tissue, and if you leave them behind, they can cause the original problem to come right back. So finding them early is absolutely crucial.
You see, the spleen doesn't just float around in there. It's held in place by several ligaments, almost like tethers holding a ship to a dock. So the surgeon's job is to carefully cut these tethers, one by one. First, they divide one ligament to get the colon out of the way. Then they move on to the next one. Each cut strategically frees the spleen just a little bit more, getting them closer and closer to the main blood supply.
And here we are at the most critical step, cutting off the spleen's main blood supply. This takes incredible precision, but there's a really clever strategy here. That final ligament, the splenophrenic, they intentionally save it for last. It acts like a natural retractor, holding the spleen perfectly still while the surgeon does the super delicate work on the vessels. It's just a beautifully logical sequence that makes everything safer.
And here it is, the answer to our big question. Once the spleen is totally free, it gets placed inside a special high-tech bag, all while still inside the body. Then, they pull the bag's opening up to the largest incision site, and the spleen is broken up, or more salated, safely inside that bag. This lets them remove it piece by piece through that tiny opening. After a final, thorough check for any bleeding, the main procedure is done. It's a truly ingenious solution to a really complex problem.
But the journey isn't over just because the patient is wheeled out of the operating room. A truly successful surgery means you also have to successfully navigate the recovery period, which, it can have its own set of challenges.
So one common issue is something called delayed gastric emptying. And get this, a surprisingly high number of patients, we're talking between 14 and 45%, can run into this. It's basically a temporary thing where the stomach just doesn't empty as fast as it should, which can lead to nausea or bloating. The good news is the medical team is totally prepared to manage it while the body gets back on track.
Now this part is a fantastic example of some real medical detective work. A hemorrhage, or a major bleed, is obviously a serious concern, but when it happens tells the doctors a whole lot. If there's an early bleed, say within 24 hours, it usually points to a technical issue from the surgery itself, and that often means another trip to the OR. But a late bleed, that's typically caused by inflammation, and the treatment is completely different, a much less invasive technique called embolization, which has a really high success rate.
So how do the doctors even know there's a problem? Well, they are watching for very specific red flags: a big drop in red blood cell count, a super fast heart rate, low blood pressure, or if the patient needs a blood transfusion. Any one of those signs is a clear signal for the team to jump in and act immediately.
All right, so after navigating any of those potential hurdles, the patient's focus can shift entirely to healing and just getting back to normal life. This is really the final and, you could say, the most important phase of the whole journey.
Back in the hospital, recovery is this comprehensive, all-hands-on-deck approach. I mean, beyond the obvious pain management and IV fluids, patients are given blood thinners to prevent clots, they're encouraged to do breathing exercises, and, this is a big one, they're helped to get up and start moving around as soon as it's safe.
That first follow-up visit after leaving the hospital is such a huge milestone. It's a chance to check on the healing incisions, take out any last stitches, and, really importantly, talk about the lab results from the spleen. This appointment really marks that transition back to normal life.
And when you think about all of this, the incredible precision, the careful planning, the way they manage complications, it all really boils down to this one powerful idea. The skill we've just seen isn't some kind of magic. It's a result of relentless practice, which leads to improvement, which is always striving for perfection.
The world of medicine is just filled with procedures as fascinating as this one, blending science and skill and strategy in these incredible ways. So the only real question left is, what should we explore next? Thanks for joining us.